Thanks for joining us. I'm going to do a brief introduction just while everyone's logging on here. Celine Gounder, Dr. Celine Gounder, for those of you who may not know, she's one of the world's leading infectious disease experts. She's an ID specialist, epidemiologist, journalist, and filmmaker. She works for CNN. She's one of the medical analysts. She's also CEO of Just Human Productions, and she's also faculty at NYU. She's host and producer of In Sickness and in Health, a podcast on health and social justice.
Oh, and just to correct that, so that's that name changed a couple of years back. So our podcasts are American Diagnosis, which is about health and social justice, and we launched Epidemic in February of last year, and the first season is on the COVID pandemic.
Oh, wonderful, wonderful. She's written extensively for the New Yorker, the Atlantic, the Washington Post, Reuters, Sports Illustrated, and Bloomberg. She's a frequent expert guest on CNN, MSNBC, HLN, CBS, BBC, MTV, and Oprah. She's best known for her coverage of Ebola, Zika, and the opioid abuse epidemics, and is currently making Dying to Talk, which is a documentary about the Ebola epidemic in Africa. She has studied tuberculosis and HIV extensively. While she was faculty at Johns Hopkins, she was director for the Gates Foundation-funded Consortium. She later served as assistant commissioner and director of the Bureau of TB Control for the New York Department of Health and Mental Hygiene. Notably, she was on President Biden's task force, COVID task force. And as background, she received her BA from Princeton University, her master's from the Johns Hopkins University, her medical degree from the University of Washington, and completed her residency at Mass General, Harvard, and her fellowship at Johns Hopkins. She was elected as a fellow of the Infectious Disease Society of America in 2016, and she's here to talk about the ever important topic of, are we indeed winning the war on COVID? There's been some major CDC announcements as recent as yesterday. So, Dr. Gounder, please tell us, there's been the announcement that if you're vaccinated, you can go without a mask, indoor and outdoor. What are your thoughts on that?
I think if you look at the science, we have gathered enough real world evidence. So people, not just in clinical trials, but people out in the community who have been vaccinated, that for those people, it is indeed safe for them to drop their masks, whether they're indoors or outdoors. I think where it gets complicated is that not everybody has been vaccinated. A lot of people have not had access to vaccination. Children under 12 definitely cannot yet get vaccinated. And so what does it mean for them? I think you are going to see certain places, certain workplaces like healthcare, for example, where you and I work in a hospital, many school settings, and travel, airlines, for example, where they may still require masks. I think it's difficult for them in this current moment where you don't have a way of verifying somebody's vaccination status, that they may still, in lieu of verifying vaccination status, just require people continue to wear masks. For people who are not vaccinated, there is still a very real risk. We still have very high rates of community transmission in many parts of the country, including here in New York City where I live. And you might say, well, if you haven't been vaccinated, just wear a mask. That's not always so easy. If you have a lot of pressure from your community, from your family or friends not to do so, even though you may be at risk for disease, you may feel uncomfortable now wearing a mask. And I think that is an issue. And then finally, you might say, well, that's your personal responsibility. It's on you to wear the mask. If you haven't been vaccinated, it's on you to get vaccinated. But ultimately, when people get sick, that does fall on all of us on some level. I end up taking care of that patient in the hospital. Somebody has to pay the bills for that. And eventually that does fall on the shoulders of taxpayers. So I do think we need to think about some of the consequences of this. And really, most importantly, if somebody's wearing a mask, don't assume anything about them, don't judge them, don't stigmatize them. They should be encouraged to do so if that's what makes them comfortable and is what is safe for them.
That's a very interesting concept, talking about how people with masks may kind of become a pariah, unfortunately, even though they're doing what is socially responsible. And then you spoke about vaccinations. We are still currently vaccinating over 2 million people a day. As an ID specialist, how amazing is that to be vaccinating at that rate?
I mean, this is really stunning what we have been able to accomplish in the past year. And I think it really speaks to the people who have been in charge of the vaccine rollout in the last couple of months, really understanding operations. So this is not about understanding science. This is just about understanding, things like supply chain and how do you get something from here to there under the proper conditions and the right numbers, and all of those kinds of things. And I think, this is what it means to run things like an efficient business, frankly, and they have done so. So I think that has been really impressive. This is unprecedented, the way that we have stepped up and been able to not only scale up vaccine manufacturing, but get those shots into arms.
Yeah. And, like, just for the lay person, everyone hears the term herd immunity go out there. And as a doctor, as a scientist, we obviously know what it is. But for the lay person, just try to explain, what does that mean and why are we trying to achieve herd immunity?
Yeah, so herd immunity has a very specific definition, which is that enough people in the population have been vaccinated that the virus has nowhere to go. So imagine, I love this, comes from Catherine Wu, a writer for The Atlantic. I love this analogy, though. Imagine you're in a rainstorm and everybody around you is carrying an umbrella except for you. Because you're so close together in a crowd, you're under their umbrella, even though you may not be carrying an umbrella. And I think that, that's a great image if you're trying to understand what is herd immunity. But even if we don't reach herd immunity, and I really do not think we will, I think there are enough people in this country who will choose not to be vaccinated, who may continue to have access barriers for whatever reason. I don't think we're going to get there. And right now, the current estimates are in the ballpark of 75 to 85% of people be vaccinated to get to herd immunity. And some people, well, why can't you give us an exact number? What exactly is the threshold for herd immunity? That's, first of all, it's very hard to estimate. And second of all, as the virus mutates and it becomes more infectious, which is what happened with the B117 UK variant, as it mutates and becomes more infectious, you have a moving target. The more infectious the virus, the higher the level of herd immunity. So maybe at the beginning of the pandemic, it was around 75%. Maybe now it's around 85% that you would need to hit. But it is a moving target, which is why we cannot give you an exact number. But that said, there are benefits to vaccination, even if we don't hit herd immunity. There's the individual benefit of you not getting severe disease, ending up in the hospital and dying. And you're much less likely to transmit onward to other people if you've been vaccinated. And so there is a synergistic additive benefit of people around you being vaccinated, that reducing your risk on top of your own vaccination, even if we don't hit herd immunity.
So if we don't hit herd immunity, and this is a very controversial topic, are you saying that this pandemic will go on forever?
No, not at all. What makes the pandemic go on forever is that we are in a crisis situation where hospitals are overrun, where ICUs are full, where people are dying. Over the winter, the numbers of deaths we had per day, over 1,000 or 3,000, I think, at the peak per day. That is a pandemic. That is a public health emergency when this is spreading out of control around the world and causing that kind of devastation. Do I think the virus will become endemic, which means that it is transmitting at a certain level in the community? Yeah, I do. I think it's going to become like other coronaviruses. It'll be much better controlled, where you're not getting hospitals that are swamped with cases. You're not going to have the kinds of deaths that we've seen because enough people will have been vaccinated. But I do think, as an infectious disease specialist, will I see, elderly people with chronic medical conditions ending up in the hospital with severe COVID like I do with the flu? Yeah, absolutely. And I do every year, except, in fact, this past year was the only year I have ever been in the hospital working as an infectious disease specialist where I did not have people hospitalized for influenza. And it's because the mitigation measures were so effective, not just for COVID, that it really prevented flu transmission as well. But this is something that I think we will have to learn to live with on some level, because not everybody will choose to be vaccinated.
Yeah. And, how are we doing compared to the rest of the world? The US versus, I know Europe had a bunch of recent shutdowns. South America had a bunch of recent shutdowns. Are we doing relatively well compared to other civilized nations?
I think it's a combination of really doing well over the last couple of months with vaccine rollout and also a bit of luck. We are now vaccinating faster than the folks in the UK, the Brits, and the UK and Israel really in the beginning were those farthest out ahead. If you go back to December or so, they were leading the world. And I would say now we haven't quite hit the same vaccination coverage rate, so the percent of the population that's been vaccinated, but the rate at which we're going, we will soon outstrip them. And so that really is amazing that we've been able to catch up and now are on the verge of surpassing them. In terms of those strict lockdowns that were reimposed in the UK and Europe in the last couple months, and then also what's happened in Latin America, let's talk about the European countries first. What happened in late 2020 is you had the emergence of the UK B117 variant. That variant is more infectious, which means it spreads more easily from one person to another. And so if I have it, I'm going to infect more people than if I had an original strain. And this is what led the UK to have to re-implement strict lockdown measures over the winter holidays. That same variant spread to Europe afterwards, and that is what led to a surge in cases in Europe. You got hospitals in Paris, for example, that were completely overrun again, ICUs full again. So they also had to re-implement strict measures. And it wasn't until really after that that this variant hit the United States. And where it hit was states like Michigan, Minnesota, Illinois, that upper Midwest Great Lakes states. And those states did see a surge. The reason I'd say there's some luck involved is we were farther along in vaccination. We had a bit more time to get people vaccinated before that variant hit us. And so we were lucky as compared to the UK and Europe, where they were much earlier in their vaccine rollout, and so we're hit harder. And so what we saw here is when that variant came to the US, we did see a surge in the upper Midwest, but it didn't go beyond that. And we saw an uptick in cases and deaths, and then it went back down. So we did get lucky.
And so I would say that one thing about the US, which has been more particular compared to Europe or let's say South America, is the virus has been very politicized, as everyone knows. And how important is it to separate the politics from the science? And why is that such a major issue in the US where it doesn't seem to be as big of an issue in other countries?
Well, I think, unfortunately, we're extremely polarized in this country in this moment. There's not really a sense of collectiveness, of collective good, of a collective public way there is in some countries. And these things very quickly get turned into cultural wedge issues. I mean, really, why should wearing a mask be a cultural wedge issue, a political issue? I mean, that's like turning toilet paper, do you use toilet paper or not, to a political issue. That way, this is a sanitary measure. It's crazy that this became politicized. And we know that from other epidemics as well, that when, politicizing a pandemic or an epidemic is one of the worst things you can do from a public health perspective, because immediately, once you do that, you have people who will be for or against a public health measure based on their politics, not based on the science, not based on their health. It's more about group identity and affiliation. And then also, if you have somebody of one political party, recommending something, even if you're of the same political party, you might say, well, I don't know, what's their ulterior motive? What is it that they're really after? And so that's also really problematic.
Yeah, I mean, it seems like something which has just gotten out of control in this country. And when it comes to vaccinations, many people think that once you're vaccinated, it's kind of carte blanche to do whatever you want. Is that entirely true? What kind of precautions should people who are fully vaccinated still take?
So I think this is what concerns me about the CDC guidance. So the CDC provides guidance for the entire country. So in some ways you should think about it as a floor, like a minimum that we should be doing across the country, and then tailor what you're doing based on what is happening in your community. And I don't think that was really well communicated. There are counties where lots of people have been vaccinated, transmission rates are very low, where it is perfectly safe to drop your mask even indoors, regardless of who's around you, because probably most of those people have been vaccinated and are not infectious. There are other parts of the country where that may not be so safe. And so I do wish that the CDC had said, look, this is the minimum. If you're in a place where lots of people have been vaccinated, that the rates are low, feel free to get rid of your mask. But if you're in a place where not many people have been vaccinated, where there still is a lot of transmission, hold on to your mask, at least when you're indoors. I think that would have been the right advice. I think what's been challenging is communicating nuance throughout this entire pandemic has been very difficult. I feel like people want black or white answers. What's the number for herd immunity? Do I need to wear a mask? Yes or no? Not, and our answer is, it depends. It depends on, and I think that's really hard to communicate. But that's where the truth lies.
Yeah, and you're talking about different states, different environments. California was on lockdown, it seemed like forever, whereas here in Florida, our governor basically said, essentially, there's no restrictions, no precautions. There's no rules against masks or what have you. What are your feelings on the view here in Florida with our governor essentially saying that there can be no possible restrictions based on the virus here?
So Florida, big picture, is a really interesting case. And I think it's an example of how little we still understand about the virus. Why is it Florida was able to get away with much less in terms of mitigation measures, restrictions, masks and social distancing and the like? We don't have a good answer to that. Is that because of the climate? That was a question that was being asked about India before India had its surge. How did India escape, that kind of devastation? Of course, now they're suffering that. We don't have a good answer to that. Maybe it's temperature, humidity. There's a lot of theories about that. I do think what Governor DeSantis is doing is really unfortunate, because I think it's actually going to hurt business. I think the cruise industry is a really great example of this, and tourism in general. People will not take a cruise if they don't feel it's safe. And, some people will feel it's safe and they will still take that cruise, but, maybe half or so who might have taken it will say, you know what, it's just not worth it. And so I think by preventing businesses from doing what they think is right for their business, for their clients, for their employees, I personally find it a little surprising. I would think you would want to let the business private sector to do what's right for them. But I think it's going to hurt business.
Yeah, I think down the road, I totally agree with you. I think it looks great now, but I think down the road, we're certainly going to feel the effects. Getting back to the anti-vax movement, because I find it so intriguing. Many anti-vaxxers don't really have a good rationale. There's these conspiracy theories that seem like they come out of nowhere. There's really no science behind many anti-vaxxers' reasons to not get the vaccine. And you, as a scientist, knowing the data, knowing the science, what do you say when you meet someone who doesn't want to get the vaccine? Obviously, it's their prerogative, but they have some kind of crazy rationale for not getting it. Like you're gonna become a 5G tower that Bill Gates made the vaccine, and you're gonna be transmitting data. Like, what do you say to people like that who clearly are just not understanding the whole science?
Yeah, well, frankly, if you're worried about being tracked, you need to throw away your smartphone, your cell phone. That is a tracker, and that is a very real tracker. They can track exactly where you're going on if you have Google Maps, for example, on your phone and you have not disabled that tracking feature, they know where you are. I think that needs to be put into perspective. But that said, if I have a patient like that who I'm speaking to, I kind of back up. I start with asking them just about how the past year has been. What that's been like for them, that's been like for their family, what it's meant for their ability to make a living. have they lost their job? Have they been able to make rent? Have they been evicted? All of those kinds of things. I asked them about, have they had COVID? Obviously, have family members had COVID? Has anyone in their close circle network died from COVID? What has that been like? I really try to understand where they're coming from, what this past year has been like, and then go from there. And then, and then I might ask them what they know about the vaccines. And only then would I ask them for permission to tell them and educate them a bit about the vaccines. And I find that often these are conversations that need to take place over time, that it might require a couple conversations. This is with respect to vaccines in general, before somebody comes around. So I think we need to be a little bit patient in trying to convince people.
And when they tell you that we just don't know enough yet, there's not enough data, even though there's been millions of vaccines given with only a handful of side effects, people who just say that we just don't know enough yet and there's not enough data. What's your answer to people who say that?
Well, this is one of the couple common strategies that's used by people who are anti-vaccine. You have people who cherry pick data, people who falsely frame cause and effect. I had Cheerios for breakfast this morning, and then I had a heart attack. Did the Cheerios cause the heart attack? Probably not. And similarly, people will blame things on the vaccine because there's some sort of time association. But another one is impossible expectations. We have these expectations that vaccines are perfect. We do not have those expectations for much of anything else. And so that's one. Two, in terms of follow-up, safety follow-up, we now have over 1 billion with a B doses of vaccine, of the COVID vaccine, that have been administered around the world. Here in the United States, it's over 250 million doses that have been administered. So, we have a lot of numbers of people who have been vaccinated. So then people will say, well, but it hasn't been that long since they were vaccinated. Well, here's the thing. At least with all of the other vaccines that we have, and we have many, some of which are related to the same technologies that are used in the COVID vaccines, all of the side effects we have seen with those other vaccines occur in the first 8 weeks, the first 2 months after vaccination. And this is precisely why the FDA would not review the vaccines for emergency use authorization until they had collected 8 weeks of data on study participants. That also meant they could not review the safety data until after the election, because that was just the timeline. It took that long, they didn't meet that 8-week safety data collection until after the election. But that said, that's the time frame in which we always see side effects with other vaccines. We did not see any issues in that 8-week period. And so I think that really does testify to the fact that these vaccines truly are safe.
Yeah, it's a matter of just kind of winning over those anti-vaxxers. And I can tell you, as a doctor, it's very frustrating talking to them. And I like your strategy of kind of backing up, building that trust, and trying to understand why they're hesitant. Another thing that's come up as a big question is, how do these variants affect the current vaccine, right? So we've gotten vaccinated against the standard COVID-19. There's different variants, that are here, variants that are going to be coming in the future. Are we going to need a booster? Are we going to need a different shot? How does that affect the currently vaccinated Americans?
So first, stepping back a little bit, there's 3 different ways the virus can mutate and become a variant that we worry about. One is that the virus becomes more infectious. So that's like the B117 UK variant. And that affects vaccination in that with more infectious variants, you need a higher level of vaccination to reach herd immunity. You can also have a variant that causes more severe disease. And then finally, third is you have a variant that evades the immune response. And so really your question is about that. And there are two main variants that we worry about with respect to evading immune responses. So it can evade the natural immune response, or it can evade vaccine immune responses. The B1351, which is the South African variant, does evade natural immune responses, as does the P1 variant, which is the Brazil variant. the vaccines remain effective against all the variants right now. But when we see a signal that they evade the natural immune response, you might have had an earlier infection and then get reinfected with these variants and get really sick. I mean, this is what led to the big surge in Brazil and in much of Latin America. This is sort of a red flag for people like me who study this stuff, for the vaccine manufacturers, that we need to stay a step ahead of the virus, and that we do need to be developing, next generation vaccines. Will we need booster shots, and will we need booster shots every year? I think the answers to that are yes and no. I think we will need booster shots in the short term. But this virus mutates very differently from the flu virus. And without getting into all the nitty-gritty genetics of viruses, the flu virus can mutate in much more dramatic ways from year to year. And so that's why we have to vaccinate for the flu every year. Coronaviruses are probably more similar to something like HIV in that in the couple years after what we call the spillover event, so where the virus goes from animals to humans, in those first couple of years, the virus is adapting to its new host. And so you're going to see a lot of mutation in the first couple of years. And then once it's really adapted, that's where the mutation rate will likely level off, plateau. And so what I anticipate is that in the first couple of years, we will have booster shots. I don't yet know with what frequency, and that will taper off as the virus adapts to us.
And so, it looks like our numbers are going down. There's a lot of optimism in this country. Again, the new CDC guidelines, not wearing a mask. What can we do better as a country here as we're trying to finish off this pandemic?
Well, I was looking at data from the Kaiser Family Foundation this morning. So they've been doing survey after survey over the course of the pandemic to help figure out, what public health officials, people like me, should be thinking about, what we should be doing. And one major gap that I see is the Latinx community. If you look at how many of them have been vaccinated, how many of them want to be vaccinated, there's a lot of unmet demand, a lot of people who want to be vaccinated, but haven't or can't. And some of the reasons they haven't or can't are, one, having services available in Spanish. So being able to make your appointment in Spanish, being able to get information about vaccination in Spanish, being able to go to a vaccination center where somebody speaks Spanish, that's a major barrier. And I think other non-English speaking immigrants to this country are probably experiencing some of the same thing. Being able to take not just time off work to get vaccinated, but what if you have side effects? What if you don't feel well for a day or two after your vaccination? Can you take paid time off work? I think that is a major issue because many of these people are working in frontline essential worker kinds of jobs where you're paid by the hour. And so those are very real lost wages. If you're having to take, 3 days off or so around 2 vaccinations, that's a lot of money.
Yeah.
So those are the kinds of things I think we need to do a better job of addressing. Also, immigration status. It seems to be an issue in this group where they're worried. It's not just conservatives who are worried about being tracked by the government. These are also folks who are worried, if I go to a vaccination center, are they going to find out something about me that might jeopardize my status in this country or, my family? So I think that's a big gap that remains really unmet.
And is that being worked on by the CDC or the White House, to your knowledge?
Yes, I know that they are aware. I know that they're working on this, but I think there's a lot more work to be done.
Yeah, I'm sure. It sounds like it. This is the last question because I know you're super busy and we're going to wrap it up. And it's obviously the hardest question. Give us your kind of crystal ball, Dr. Gounder. What do you see in the next 6 months, 1 year, 2 years with this pandemic?
Well, I think it is still raging around the world, and I think we really need to pay attention to that. I think, unfortunately, and I saw this happen with Ebola as well, we really just checked out, frankly, on what was happening once we thought we were safe and it wasn't a problem here. And I think what we really need to understand is that, for example, India, if you allow the virus to spread in that way, you will have more mutation, more variants. We have a India variant now, the B1617 variant, which also seems more infectious. It will eventually come here. We know that. There is no way to prevent that from happening, regardless of what kind of travel restrictions or other things you put in place. And so that really does threaten our safety, because these variants could be more infectious, cause more severe disease, and evade our vaccines potentially. So setting aside the humanitarian motivations to help the rest of the world, which I frankly think we should, from an ethical perspective, from a selfish perspective, we really should be addressing what is happening around the world. So that I would put that front and center. In terms of our situation here, the Pfizer vaccine has now received authorization for the 12 to 15-year-old age group. Moderna will be submitting their vaccine for the same for 12 and up very soon. Johnson & Johnson is somewhere behind them on that. And so I think we're going to be seeing a lot of vaccination of adolescents over the summer, especially leading up to back to school. I think that's going to make return to school feel a lot safer, especially for junior high school and high school kids. That's also the age group where we did see more transmission in kids. So it's really good that we're able to vaccinate them now. I think you're going to see some places where we're still wearing masks, like I mentioned, schools, other educational settings, healthcare, planes, and other travel settings. I think vaccination rollout will continue. Big picture, I think we're going to have to be more tailored, hyper-local in our approach. We're going to definitely see primary care physicians having to be a lot more involved. We're not going to be able to do that same sort of assembly line mass vaccination approach. It's going to have to be a lot more one-on-one conversation, bringing people around. And then, a couple of things that we are worrying about, you could say, in the back of our minds. One, will we see potentially another surge in southern states like we did last summer, especially southern states that have lower vaccination coverage? We know the Southeast in particular, the vaccination coverage has not been as good. And again, we don't understand really how weather, climate might interact with the virus and the spread of the virus. And then what are we in for next winter? That's another period of high risk for another surge among unvaccinated people, and we just don't know. So those are things we're going to be on the lookout for, and crossing our fingers and our toes that doesn't happen. But we'll definitely be aware and keeping track of what's happening on the ground.
Yeah, I mean, it sounds like you're cautiously optimistic, and I think that's the general kind of consensus that you see in the media, is that we're doing great. Vaccination rates are great. Numbers are going down. There's light at the end of the tunnel, but everyone's got to do their job. People need to get vaccinated, understand the science, understand the data, and hopefully we can get out of this in some reasonable time setting. So listen, again, thank you so much for your time, Dr. Gounder. It's been a real pleasure talking to you. Thanks for all you've done in terms of, leading our fight against this pandemic. And we really appreciate all your insight.
No, thank you for having me here today, everybody. Get vaccinated, stay safe, and be well.
Absolutely. Take care. Thanks again.